The healthcare dynamic is rapidly changing. Understanding the basic fundamentals related to the business of medicine empowers practitioners to advance their skills in and knowledge of the business aspects of medicine. SMA's Business of Medicine Simplified program explores the essentials of everything from reimbursement and compensation models, insurance and risk management, to practice employment and business finance. As the healthcare industry moves to value-based reimbursement, providers and health systems are often caught in the crossfire of new regulations, new reimbursement models, and the potential for government incentives or penalties.
Joni, thank you for joining us today.
Thank you for having me.
So, value-based reimbursement is one of those topics that seems to be constantly evolving. What are the key areas our listeners need to know to focus in on to protect or enhance their bottom line?
Well, first and foremost, it is essential to know where your revenue is coming from. That may sound silly, but we are consistently seeing reduced fee schedules or just a lack of increase in fee schedules. And we also constantly hear that the providers are working harder for less money. This is all true. And we were used to seeing increases in those fee schedules, but now those increases are really coming from other payment models, typically a value-based payment model. One example would be our MIPS increases. Those were minimal for 2019. They were only 1.88%. That was based on your 2017 participation, and that was only if you had a perfect score. For 2020, those increases are actually even less. So all these incentives now are in fact what is replacing those old fee schedule increases. So providers need to know where and how to access those new forms of revenue. It's essential to keep revenue from going down. So there are select programs through Blue Cross. There's participation in ACOs. Those can be physician-led or hospital-led, and all the new opportunities potentially are there to increase revenue. So with the focus on reduced costs, fee schedule increases are really not how we're going to see that increase in the future. So when you're looking at how do we protect it, I think you really can't play in this quality reporting game without sufficient systems and staff to support your reporting and monitoring of the patient care. So you have to have staff who understand the new way of thinking about reimbursement. And then electronic records, as cumbersome as they are, they're really a necessity if you're going to have the same data that the payers are using to assess your value. And I know listeners can't see me, so when I say value, I always use air quotes because the definition of value is really not the same as we may define it. And each payer may have their own definition. And likewise, they use that term value to determine how much the payer will actually get reimbursed. So remember that value essentially factors in cost as it pertains to patient outcomes. So better outcomes at a lower cost is exactly the value that the payers are looking for. Both Medicare and commercial payers are using their own models to assess value based on data. And then the provider really needs that same data to know where they stand in comparison to their peers, where they are on that bell curve, and then what actions they can take to improve and enhance that revenue. If they don't have that same information, they really are kind of playing in the dark.
Yeah, so the quality payment models are moving forward and are starting to change over. So it's just critical to get, if you're not already ramped up, to get ramped up quickly because this is happening.
It is, and it's interesting because several years ago, I actually did a presentation about this as a sort of a futuristic thing, and there were some very unhappy providers because they didn't like the idea of this change, and lo and behold, it's here. So whether we like it or not, we have to be prepared for it.
There you go. So what are the most frequent mistakes practices make when looking at these new models, and what are some basic steps they can take to make sure they don't miss out? I understand there's probably different people in different places with this. Some are further along than others, but what are some of the most frequent areas, frequent mistakes or things that you think are some steps that can be taken to mitigate those things?
You know, I think one of the most frequent mistakes is pretty simple. It's just they turn a blind eye to anything other than what they already know. And it's because it's very complicated and the practice is already very busy. So most of the provider administrators, they might miss out on these new opportunities. They may think it just doesn't apply to them. And then even worse, when they do realize it will impact them, at that point, they're so far behind that the cost and the time and the effort of catching up is just enormous, almost impossible to overcome. So as we're playing in this world right now of reimbursement, we really have to have a foot in both doors. So you're really operating in the old fee-for-service model, and at the same time, you're also participating in these reimbursement models. That's going to keep you whole. So some good steps, there are several good steps. Make sure you're aware of new models, and you really have to think them through to be sure you're not missing out on an opportunity. Not every model is good for every practice. Because it worked for a colleague or one practice doesn't mean it works for every practice, but it is essential to have basic understanding of what opportunities are out there. And if it's too complicated, which some of them on the surface actually are very complicated, but our providers and administrators are smart. And when we really go over this with them, they typically get it. So if it is too complicated on the surface, they can seek assistance. They have third parties, and they can help them work through what the risk and the opportunity is. It's best to ask the questions and just ignore it altogether. I think another thing that I would mention would be small incremental steps. Rather than just the big bang, let's replace everything, you know, look at your staff, look at your systems. Do they produce what you need them to do for the future? And if they don't, what's your plan to modify and replace them? So even if your practice doesn't participate in a model, if you're a specialist and the people who refer to you are, then they have the same access to the data that tells them where you as the specialist are on the cost quality bell curve. So if them referring to your practice negatively impacts their value, again, air quotes value, and likewise the revenue, then you could lose them as a referral. And a lot of our specialists aren't even thinking about that. And then finally, I think staff can take care a lot of the administrative work that comes along with participating, but it's still really important for our providers to be engaged. They have to be sufficiently engaged, otherwise there's really not team coordination, and then there could be negative patient impact that the regular staff wouldn't know about, so the provider has to be part of that to make sure it's important. So those are some of the things that they're not hard to do, but are often overlooked. And a lot of it is because it's just one more thing added to a very busy day.
Right, and basically acceptance and then a plan for implementation that can get you there without completely disrupting what's going on. So really just kind of getting started and then first having a plan for implementation and then kind of moving forward from there and start to take little incremental steps to get a system in place that works.
And I think beyond that, it's also recognizing the impacts and the threats that come from the outside. That even again, like I said, if they don't participate, if someone they are working with does, how does that impact their practice? And I think that's very often overlooked.
Yeah, so I think that's very comprehensive, and that covers a lot, and it can sounds kind of daunting, but I think getting started is really the key, and having people that you can trust to help you get started, put a plan in place. So we're very fortunate to have you speaking at our annual meeting in November. What are a few additional areas or information that you'll be sharing with us at the meeting this year?
So I'm really looking forward to the meeting. Thank you for having me. Yeah. I think I'm going to be discussing much of what we went over today, but I'm going to be adding some details, presenting some of those specific models, and then some general guidelines on assessing opportunities and risks. So I want the providers to know that these changes aren't something they should be afraid of. And most of the practices, I think you made the point earlier, are well on their way. They already have skill sets, they already have staff in place. And so even though it can be overwhelming, I hope that we can alleviate some of their concern by having them understand the models better and teaching them how to take advantage of what they already know and what they already do, and then encourage them to build on that to be better prepared for that next round. Because there's going to be a next round as we continue to evolve. And I don't see this going away. I think it's worth mentioning that we hear a lot, or we get a lot of questions of what happens when something changes, if there's a different president, if there's a different administration, if there's a different Congress. And macro passed with overwhelming bipartisan and bicameral support. So regardless of what happens, I think the idea of measuring value in healthcare as a way to drive payment is not going to go away, no matter what form it shows itself in.
Yeah, and that makes just sense to me, coming from a manufacturing side, that you're going to continue to improve your processes, and that's going to drive costs down. That's going to provide more space for access to care. So it does make sense. It's just a sea change from what's been done in the past. So I think what you're really driving home here as well is that this is part of a continuous quality improvement process that needs to be a part of everyone's practice, that there will always be changes. It's easier to do it systematically and incrementally rather than procrastinating and waiting and then trying to do it all at once. So I think that's probably the biggest takeaway. Would you agree?
Yeah, absolutely. I mean, the practices are used to assessing their service lines, the maintenance of their facilities, and those kinds of things on a regular basis. This really needs to be thought about in the same way. You have to maintain kind of where you are in the environment to make sure you're keeping up with how you're getting paid, how that revenue is coming in, and then also planning for the future. No different than you would do if you were adding a new piece of equipment or just, remodeling your waiting room. So it's the same idea, just on the reimbursement side, which we haven't seen changes for in a long time. So it is catching people off guard a little bit.
Yeah. Well, this is excellent information and definitely a great precursor to to your talk at the meeting in November. So thank you very much for joining us today.
Thank you so much for having me.
The SMA Southern Regional Assembly takes place October 31st through November 2nd in Birmingham, Alabama. The theme is the business of medicine simplified. Visit sma.org/assembly for additional information.